Hello and welcome to this live interaction with me, Ashish Parekh, and the topic that I'll be talking about today is something that a lot of people would find very amusing. We've all grown up hearing how keeping quiet and speaking less could keep us away from dangers, and now during the pandemic this thing applies as well, as per a recent study. Wondering what I'm talking about? Well, researchers have said that more quiet zones in high-risk indoor spaces such as hospitals and restaurants could help cut coronavirus contagion risks. And they've also said this based on a study which showed that lowering speaking volume can in fact reduce the spread of the disease. Now, in an effort to rein in the transmission, a reduction of 6 decibels in average speech levels can have the same effect as doubling a room's ventilation. And this is what the study has said, and scientists came out with a press release on Wednesday. This also has been published in an advanced copy of a paper which has detailed the entire study. Remember, the World Health Organization had earlier changed its guidelines to acknowledge the possibility of aerosol transmission, such as during activities like choir practice or when in restaurants or in fitness classes. Microscopic droplets ejected while speaking evaporate to leave behind aerosol particles big enough to carry viable virus, and this paper has also shown the same fact. And also it has said an increase about 35 decibels in loudness or the difference between whispering and shouting boosts the particle emission rate by 50 times. Now, this is of course a very interesting study that goes on to show that speaking softer or rather staying quiet could help you save from the virus. And to speak more about this and to help us understand the medical reasons behind all of this, I have with me our expert for the day, Dr. Sitesh Roy, joining us to speak more about this particular news study that has come out. And of course, a lot of people would be finding this very amusing. First of all, Dr. Roy, thanks a lot for your time today. Just walk us through this study. What exactly does it mean? Because of course, in first glance, this sounds very amusing given the fact that speaking quiet could possibly save you from virus. What exactly is the reason?
So, as you can expect, Ashish, what happens is that when we are talking, we knowingly and unknowingly are releasing what are called microaerosols, very fine particles from our mouth. And we have always known this, and COVID-19 has made it abundantly clear to us in the last 7 months that when a person speaks loudly or sings, or is, for example, at a karaoke bar, or is in a club and is speaking loudly because the ambient sound and the decibel noise is so high due to music, these are some of the most prone areas for wide transmission of the virus SARS CoV2. So much so that majority of what we call the super spreading incidents that have occurred, where one individual has infected 20, 40, 60, even 90 people within one night, have all occurred in areas where shouting, singing, yelling, screaming have been going on. And so this study confirms for us now, finally with scientific evidence, that actually when we speak softly, when we speak in a lower voice and volume, we reduce the number of microaerosols that we are releasing into the environment, and hence we can reduce the transmission of the virus. Even if you look at the most recent data coming from the frat parties in US, where the maximum diseases have spread on the college campuses that have tried to reopen, it has always been in such circumstances with more than a few people and singing, shouting, yelling, screaming going on. So I think this is a great message for us to realize that we have to calm down and speak softly to protect ourselves and the people around us.
Yes. Also, doctor, now speaking about this particular study, and speaking about the conversation, the decibels that are involved. Normal conversation are is about around 10 decibel range, and ambient noise in restaurants is around 70. Now, of course, as a layman, for example, a layman wouldn't really understand what decibel range is safe, or what sort of safety should they undertake. So as a layman, our viewers, in case they're not understanding what exactly the decibels that we're talking about, how do you explain the conclusion of this study? What should they do to remain safe from the virus, especially as far as speaking or whispering or shouting is concerned?
So as you said, Ashish, when we speak at somewhere around 10 or 15 decibels.
Yeah.
If a person knows what a normal conversation is, they can have an idea of what that means. If you take a motorcycle that is revving up, that's about 120 decibels. Okay?
Yeah.
So if you can get an idea where we stand between that, as you rightly said, every 6 decibels that we go up, the amount of microaerosols that we produce goes higher.
Okay.
And so the simple process that I would tell people to keep attention to is if you are having to speak over the noise that is around you, if there's music playing at the restaurant, you have every right to tell the owners of the restaurant to turn the volume down of the music so that you don't have to speak loudly to the person who's sitting in front of you or next to you. So it literally means that every person has to take the personal responsibility to speak in a normal tone. And most people know what a normal tone is. It does not require any rocket science to know what a normal tone is. And depending on what the ambient sounds are around you, if you're in a quiet room, you will obviously speak softer. If you're in a room where there is a lot of noise going on, then you'll speak louder.
Yeah.
And so keeping an awareness about where you are and what you're in the midst of and where you are going. So if you can choose to not go to a karaoke bar or to a club where there's going to be loud music and everyone is going to be talking over the music to be heard, if you can consciously avoid those, you will be protecting yourself from catching the virus. If there is even one single person in there who has it, they can spread it to many.
Yeah.
So that's how I would tell people to look at it, is have an idea of what the sounds sound like.
Yeah. Also, doctor, on a closing note, there is one question that a lot of viewers were asking us even during our previous live interactions as well. And of course, because it wasn't really matching up to the topic that we're talking about, we couldn't really address that particular, question that a lot of people had. Now, because we are in the same topic, let's just clear the air surrounding transmission through the air, because this is something that a lot of people are talking about. They're confused about whether the virus spreads through air, like a lot of people are making out to be, given the fact that a lot of people rely on social media for information, and the kind of articles and the kind of data that you get over there, most of the things are over the top, and there's a widespread of misinformation. So, on a closing note, speaking about the transmission through the air, what is the status? What do we know about how the virus spreads, especially as far as the air transmission is concerned?
So, Ashish, 2 important points. One, there have been almost no known transmissions of the virus in an outdoor environment where people are socially distancing.
Okay.
So if people who are keeping at least 6 feet distance and are going for their morning walk, for their morning jog, for their morning physical exercise and maintaining distance, and they are not yelling, screaming, laughing, things that would create a lot of aerosols, they have their masks on, then there have been almost no transmissions known in that environment. Majority of the transmissions tend to occur indoors, where the air circulation is not good, and most air-conditioned environments are like that, where the air is fairly stagnant or held in. And in those areas also, even if you're talking to someone, maintaining a distance of 3 feet from the person has been shown to make a difference in terms of transmission. 6 feet is obviously ideal, but if it is someone known to you, then even then 3 feet of a distance. And the transmission is through what we call airborne and aerosol transmission. There has been some confusion over whether there is airborne transmission or not, but I believe that this is all semantics to me as a physician and a practicing clinical immunologist, that we have to assume that there is airborne transmission and take all the right precautions, because whether you call it a large droplet or a micro droplet, if the viral particles are in it, it's going to spread. And really getting the ventilation in areas that are closed, improving that by keeping windows open, having exhaust fans, etc., also reduces the chance of transmission within closed spaces. So again, do your outdoor activities with the right precautions and safety, and beware when you're indoors and with people around you, and use your mask, use your hand washing, hand sanitizing, maintain your physical distance.
So there you have it. That was Dr. Roy clearly addressing one of the questions that a lot of viewers were asking us, and it's been something that given the fact that there is a lot of misinformation on social media, a lot of people are confused about, and there has been some sort of a panic as far as that is concerned. And clearly, the fact that we were being asked that a lot went on to show how many people were still unaware about airborne transmission and its possibilities. So Dr. Roy there clearly giving his 2 cents about the particular topic, and given the fact that he is dealing with all of these cases now, also adds value to this particular discussion that is surrounding airborne transmission, and also the topic that we spoke today about being quiet. So that was our live interaction for the day. Keeping quiet could save you from COVID-19, like it saves you from a lot of other things in life. So make sure whenever you are in public place, do not really shout or scream, given the fact that aerosol transmission is something that is a real possibility, and because of the fact that we do not still know a lot about the virus, this safety is better than risking our lives going out and shouting in public places. So that's it for the day, guys. Do let us know what you think about this particular video in the comment section, and also do not forget to like, share and subscribe to News9 Digital, and also remember, stay home, stay safe and keep quiet. Thank you.